Welcome in. Go ahead and take a deep breath and just settle in for a moment. In this explainer, we're going to be diving into a deeply personal, almost vulnerable experience, and that's the therapeutic truth of pain and healing. We're going to completely demystify those intense sensations you feel when you're on the treatment table and look at exactly what is happening beneath the skin during a professional manual therapy session.
You know, it is literally the most common question I hear in the clinic. Why does this have to hurt so much? When you're lying there, it's completely natural to have these doubts. You might be thinking, okay, is this therapist just way too heavy-handed? Or why does the person in the next bed look like they're at a spa while I'm over here sweating? You might even wonder if more pain automatically means better results. Trust me, those fears are totally normal.
But to put your mind at ease, we really have to look at the philosophy driving professional care. True clinical therapy, right, it's rooted in deep professional expertise and incredibly precise intervention. We don't believe in just using brute force, not at all. Every single adjustment, every technique we use is carefully, meticulously tailored to your specific physiological needs and your unique pain threshold. To really get this, we actually need to completely reframe how we view pain. The discomfort you feel during a professional treatment, it's not suffering. Actually, it's more like a deep conversation between you and your body. Think of it as your tissues finally speaking up, finally revealing their hidden reality after months or maybe even years of enduring silent stress. Understanding the why behind this conversation is the absolutely essential first step to your healing. So, from a clinical perspective, there are four main truths driving this therapeutic pain. We're talking about inflammation and metabolic waste buildup, fascial adhesion, nerve hypersensitivity, and finally bone and joint displacement. Let's break this down, starting with what's actually happening with your fascia. So, inside your body, healthy fascia is supposed to glide smoothly, kind of like silk. But thanks to long-term poor posture, this tissue gets dehydrated and literally sticks together like glue. We call this adhesion. When your therapist goes in to manually release these adhesions to get that elasticity back, it feels pretty uncomfortable. But that discomfort, that is simply your tissue reclaiming its rightful space. Now let's talk about that inflammation. Think of chronic muscle tension like a severely blocked drain. Your muscles are existing in the state of ischemia, which basically just means they're starved of proper blood flow. This causes a massive buildup of lactic acid and metabolic waste. When we apply precise pressure to these specific areas, it's literally like taking a plunger to that drain. That pressure instantly lights up your nerve endings, and that's what gives you that very distinct, deep, aching soreness. Now, you know, if you've been hurting for a long time, your brain actually becomes hypersensitive. It throws your whole body into this high-alert defense mode. Your muscles tighten up instinctively just to protect those misaligned joints. So to realign those joints, we have to overcome that tense, locked-in resistance. It does cause a fleeting moment of pain, but the beautiful part is, it's almost instantly followed by profound relief. Because of all this, you really need to become the expert on your own body. And that means knowing the critical difference between good pain and bad pain. Good, therapeutic pain is intense, sure, but it comes with this satisfying release and a relaxing warmth. Injury pain, on the other hand, that feels sharp, it stings. It might even feel like a sudden electric shock. If you ever feel that bad pain, you need to speak up and tell your therapist immediately. Okay, so practically speaking, how do you handle being on the table when things get tough? First off, do not hold your breath. Breathe deeply. That actually aids circulation and helps flush out all that metabolic waste we talked about. Second, give us honest feedback. Your voice helps us accurately assess what's going on with the tissue. And finally, commit to the process. Look, the first session is almost always the most uncomfortable because your tissues are at their absolute stiffest. Stick with it, and that pain will consistently diminish over time. I really want you to take a second and let this sink in. Pain is not the enemy, it is your body's alarm system. I'll say it again. Pain is an alarm system. We aren't here to fight your body, we're just here to answer its alarm. The ultimate goal of every single adjustment and every momentary ounce of therapeutic discomfort is to support you comfortably and safely straight through the healing phase. So the next time you feel that deep ache on the treatment table, I want you to ask yourself this: are you just enduring discomfort? Or are you finally listening to what your body has been trying to tell you all along? Pain isn't your enemy, guys. It is literally the gateway to your recovery. Thank you so much for joining me for this explainer. Keep listening to your body and keep exploring.